What's going on? This is David from Elevated Physical Therapy and Fitness. Today I'm going to go over some CARs or controlled articular rotations, particularly at the hip. This is where I personally find the most benefit from it, and a lot of my patients notice some good relief with this as well, just to help with some of that hip mobility at the end ranges that you don't normally work into some. So usually having something to hold on to, like a support beam or the rig or something along those lines, squat rack, whatever. But then you're gonna bring this hip up into flexion, right? Rotate it out. Rotate again so that that foot's back behind you, and then bring it back down to you. Then you're gonna go through those exact motions in reverse. So now I'm coming out to the side, I'm rotating back down, and I'm bringing it through, then I can come down. The goal here is to just let the hip do the work and go through the range of motion of the hip. It does you no good if you run out of motion here to do a bunch of twisting at the spine or your pelvis or something to try to manufacture more range of motion there. The whole goal is to work on the hip joint itself that you're working on. So you just work within your available range and push those limits as you can, right? But if that's what you've got, then that's what you've got. We're not here to, see who can kick out to the side the furthest. It's just whatever your motion is, we're trying to make that better. And or make it more comfortable to achieve that motion, because sometimes getting to those end ranges can get kind of that pinchy feeling, that impingement, or it just takes you a bit of warming up before you can get there. So this is a good one to use, pre or post activity, depending on what your goal is. All right, so give that one a try. Let me know what you think.